Are you experiencing persistent pain in your hip that doesn't seem to go away, even with medication? Do you find it difficult to perform everyday activities like walking, bending, or even getting in and out of a chair? These could be signs that you may need a hip replacement. If you notice that your hip pain is affecting your sleep, or if you experience stiffness that limits your range of motion, it's important to consult with a healthcare professional. Additionally, if you have tried other treatments such as physical therapy or injections without relief, a hip replacement might be the next step. Another sign to watch for is if your hip pain is causing you to limp or if you feel a grinding sensation in your hip joint. These symptoms can indicate that the cartilage in your hip has worn down, leading to bone-on-bone contact. Remember, early diagnosis and treatment can significantly improve your quality of life. If you're experiencing any of these symptoms, don't hesitate to seek medical advice. A hip replacement could help you regain mobility and live a pain-free life.